So both PROSPER and SPARTAN were similarly designed studies, large studies of over 1,000 patients and well-controlled studies. The average age in both studies was 74. And we know that both of these studies led to treatment, on-treatment times of several years, with a median time to metastasis on treatment for PROSPER of 36 months and for SPARTAN of nearly 40 months. So this is an older population that we know is at risk for sudden death and other unrelated complications. That was captured in the PROSPER study and presented as such. And their endpoint was specifically defined as a composite of both radiographic progression or death while on drug or within 4 months. With a 2-to-1 ratio, there were more events in the enzalutamide arm than in the control arm, both because of the length of treatment and the exposure to drug. At the end of the day, what we saw for events represent about 3% of the entire population. To me, that represents the natural history of this disease in this older population. We don't have data specifically on these events and how they were attributed, so I think it's a little bit early to say that there is a safety signal based upon this data. We did not see this result reported in SPARTAN, so we don't know if this is similar, but looking at the overall survival curves for both studies, they are overlapping with placebo for the first 2 years and then begin to separate. So in my opinion, there's probably not much difference between these drugs in this population. I don't believe there's a significant safety signal, but it's an older population, and death from comorbidities is something to take into account when we're considering treatment with these agents.